Alright guys, so another thing that could actually result when there's problems in the central nervous system or respiratory system is when you're having visual disturbances. Alright, so visual disturbances, yes, your eyes are kind of like crazy. Sometimes it might even be aching, causing you some headaches. Do you understand? Then yes, you might now be seeing blur and all of that. Okay, so let's discuss it how these visual problems are actually linked to the central nervous system and what conditions could actually bring them up in the respiratory systems too. So visual disturbances they actually arise from various problems within the both the central nervous system and the respiratory system. Alright, so in the central nervous system, they could actually result from issues like what optic neuritis, migraine auras, stroke. Okay, so migraine auras is kind of like it's just like a headache, you understand? Alright. So stroke now down there is reduced or there is total block of blood supply to the brain. It can now cause what loss of vision in one eye or just two eyes, okay, and all of that. Then brain injuries. So traumatic injuries affecting the visual cortex or pathways could actually lead to what various visual problems too. Then how is it linked to the respiratory system? What are the possible conditions in the respiratory system that could actually cause a visual disturbance? So in the respiratory system, you now be having things like if there's hypoxia, the oxygen supply to tissues is basically low. There's hypoxia, you now have those problems coming up. Okay. So if there's reduced oxygen levels like in problems like what? Chronic obstructive pulmonary disease, severe asthma, all of this could lead to what? Visual disturbances. Due to what? You're having uh, insufficient oxygen supply to tissues. You know these tissues they don't play with oxygen, especially the brain tissue. Right? The brain uses oxygen up like crazy. The pulmonary hypertension too. That one there is high blood pressure in the lungs arteries. This can actually cause what? Various systemic symptoms, including visual disturbances. Okay. So it's actually an alarming symptom, and if you experience persistent or severe what visual disturbances, it is crucial for you to always meet up with your healthcare professional. Okay. All right. So this is it for visual disturbances and how it is linked to the central nervous system and the respiratory system.